Good morning. Instead of coffee and cars, welcome to a hip tips session with JB. I'm going to try over the next little while to produce these little short videos to give someone that's looking towards having their hips replaced some advice. And the other day I did a session focused on pain relief and the pain meds you're likely to be prescribed post-surgery. I left one of those meds out of the equation. It's not a pain med, but with my dandy handy picker-up device that my son and daughter-in-law shipped from New York via Amazon, these are really important in the meds that you're going to be taking, because this is a stool softener. And if you understand and read the small print when you get a prescription, most of the Tylenol and painkiller type pills will often constipate you, and that is something that can lead to complications. If you don't take a stool softener, you're at risk of getting a bowel obstruction, which you do not want to add, I promise, to your hip issues. So today I just want to remind everybody that when you take your medication, if there's risk of it constipating you, make sure that your doctor's prescribed a stool softener. It doesn't have to be a prescription stool softener. There are over-the-counter products, but make sure you're taking it. It's kind of a shitty topic, but if you don't go to the washroom and have a bowel movement soon after your hip replacement, you can create some problems for yourself. The other thing that I really wanted to underscore, and that's why the camera is so far back, is ice therapy. You're going to see in a couple of the photos that I'll post to support this video of the bruising and the swelling that it's now accompanied the bilateral hip replacement surgery that was only done 3 days ago. So I didn't want to spend a whole whack of money on a fancy dancy machine at $400 to ice my hip areas. So what I've done is just taken freezer packs that you can buy at any drugstore, got them nice and frozen. They're pliable. I wrapped them around the hip area, not directly on the skin, and then just fastened them in place with tensor bandages. So I can sit down and at least the tensor applies a little bit of pressure to pull the ice pack closer to the injured area and provide some relief. If you don't apply a tensor and tighten it around the ice packs, then they just sort of hang loose. They're sitting on top and you're not going to get the cold effect. But you really have to consider the importance of cold therapy in addition to the painkillers, in addition to taking your stool softener. So my big suggestion is to don't get behind on the meds. Make sure you're doing all the things that your docs and the health professionals have suggested you do. And look, 3 days out, I have very little pain. My mobility is starting to come back. My leg strength is going to take a little while longer, but I'm doing really good. And this is a super device that you should add to your mobility list of items, in addition to the walker and the handrails to help you get on and off the toilet. This little device will help you grab your socks or garbage or whatever you happen to drop along the way. Makes it really easy. Thanks to my son and my daughter-in-law for adding this to my mobility list of products. Have a good day.